Welcome back to Let's Talk Patient Blood Management. I'm Marianne and I'm here with Sarah. Hi, Sarah.
Hello.
Sarah, I was just thinking, holy moly, that when we started, it was Patient Blood Management Awareness Week, and it is now Patient Blood Management Awareness Week. So that must mean that we are heading into our third season, which is insane.
It is incredible. I'm so glad we did take this on during Patient Blood Management Week because then we always have two things to celebrate.
Yeah, and I have a way to remember.
For sure.
These 2 years have flown by and it's just been fantastic. Just so full of fun and great guests and interesting conversation. So let's get right into it. We have someone here with us today, do we not?
Yes, we do. It's a good one.
All right. I think we have with us today Miss Kaycie Atchison. Kaycie Atchison, welcome to the show.
Thank you so much. I'm really excited to be here. And I just want to say major congratulations on coming into your third season. Not going to lie, I've been an avid listener since episode 1, and I'm so excited to be here with you to celebrate.
We are equally thrilled and honored to have you here. Everyone loves Kaycie Atchison. We're changing the name of the episode to Cuddling with Kaycie today, by the way. Kaycie, I notice your credentials are MCR and MLS. Can you tell us about those credentials and what you do?
Sure. I'll talk about the MLS first because I earned that one first. So my original career, I was a blood bank laboratory scientist, and I attained that certification through the American Society for Clinical Pathology, ASCP.
Yes.
And I started that through college. My major was actually medical technology. So the field of clinical laboratory science has gone through a little bit of a name change since then. And so that was my undergraduate degree. And to be a laboratory scientist, you actually have to get a separate certification through an accredited program where you do a lot of both lecture and lab experience in all of the major areas of the laboratory. So chemistry, hematology, coag, microbe, and blood bank. So once I earned that, I have what is my MLS ASCP. And so that's my certification. And then MCR, I decided after that to obtain a master's degree through where I used to work. And I have a master's in clinical research. And that degree program was actually really focused on quality improvement projects, not just how to run a clinical research project or to be a research assistant. So it was a lot of quality improvement and how do we change things? How do we monitor for change? How are we making it a better situation? And I actually went and obtained that degree in anticipation of making a career change to what I am now, which is a transfusion safety officer. That role is really heavily focused in quality improvement and monitoring of progress. And how do you know where you are if you're not monitoring it? How do you know if what you're doing is better when you make a change? And it has come in handy so many times. So that's kind of where my credentials come from.
Oh, that makes so much sense. Wow.
Yeah.
Thank you for sharing.
Sure.
And Kaycie, I think I may have met you then when you were in that MCR program, because I remember distinctly our first meeting because I was new in my role as a patient blood management coordinator. And one day I received this random call from someone who was in their studies. They were in their college and they wanted to know about patient blood management. And I really knew very little because I was just at the beginning of my career in patient blood management. And I just said, why don't you come shadow me one day? And lo and behold, you always say those things thinking, yeah, they'll never come. And you came.
I did.
And that's when I first met you. Do you remember anything from that day or?
I mostly remember just being grateful. You're right. It was an absolute cold call. I messaged you through LinkedIn and I was like, hey, I'm really interested in this career path. What can you tell me? And I was so grateful for your invitation to follow you around and get, that first person perspective of what the job entails and how you made that decision professionally to pivot. Because I was just kind of moving in that direction of, I have a lot of experience and I keep running into these very similar circumstances. And I know I'm not the only one who feels like I'm having the same conversation on trying to provide this education to both nursing and physicians about, stewardship of blood products and why do we need to type and screen every day? And how do you determine if your patient's ready for a transfusion reaction symptoms? And so reaching out to you, I was so grateful that you invited me to come and follow you around. I learned so much. I was just so appreciative. So thank
Yeah,
you all these years later.
I remember learning so much too, because I had no blood banking
Mhm,
experience other than one day being in the blood bank with my organization. You
mhm,
sat through and told me a lot, and you gave me resources to how I could learn more about
mhm.
the blood banking aspect of things. And so, lo and behold, a few years later, I'm assigned to mentor a team Vanderbilt. They're going to start a patient blood management program, and we meet for the first time and there's a familiar face in the crowd. And you had
Yeah.
made, a geographical move
Mhm.
to pursue this career.
Yes.
So, can you tell us why you became so interested in not only laboratory science, but then blood banking and then
Mhm.
the quality side? What
Sure.
was those decisions?
Yeah, how does it go
Yeah.
from that varied MLS program
Mhm.
into TSO land? That's so interesting.
So, as a student, when you are doing kind of your internship year, you get to spend time not just in lecture, but also in the lab doing either very limited patient work, or sometimes you're doing older patient samples where you get to actually perform the testing. And I really kind of fell in love with blood bank at that time because it's all logic puzzles, and I've enjoyed those since I can remember. And it's a lot of if it's not this and if it's not that, what else is left? That's a lot of what blood banking is, especially when you're dealing with patients who have those red cell antibodies, whether they've gotten them through a previous pregnancy or a transfusion, and you're just kind of given all of these results and then being able to turn that into an interpretation, which then requires you to find blood that actually will be compatible with that patient. I very much love the puzzle and trying to solve and find that answer. That's kind of how I chose blood bank as the area I wanted to work in from the beginning. When I left my certification program, I worked for a reference lab, which is where a lot of hospitals will send their samples that they can't solve in their own blood bank with that hospital, whether it's through just they don't have enough of them from year to year to maintain a level of competency to do that more complicated work, or even if they do. So sometimes you would get those larger academic medical centers, and if they can't solve the answer, then it's really going to be complicated. I would get samples from a bunch of different hospitals and get to work on much more complicated situations. Working there, just I learned even more about the science behind it, and it just continued to further my interest. And after I left that job, I've worked in two other hospitals with their blood banks. Each time I've been able to spend more time with nurses and spend more time with providers, various physicians, CRNAs, and other advanced practitioners to keep kind of addressing the same question of they spend so little of their own education learning about transfusion medicine because they have so much to learn. They have to learn all of that and they squeeze in this transfusion medicine where they can because not every provider is going to ever prescribe a blood product. Not every nurse is going to transfuse a blood product. So it's just priorities, right? And so I realized that there were a lot of common themes. And the further I got in my career, the more time I got to spend with them. Being able to kind of conceptualize there's got to be a role out there that spends time doing this education, giving the background, helping understand what's going on behind that window, right? So you have a lot of interactions, whether it's over the phone or at the window in the blood bank where someone's showing up. And usually if somebody's there, it's not good news for the patient, right? They're picking up large quantities of blood at one time. Having those conversations ahead of time builds that trust. So in that emergency situation, everyone is able to collaborate and understand where the other side is coming from to get the best response for that patient. I really appreciated trying to have those conversations ahead of time. So that way when we needed to, we could just trust that the other person knew what was going on and that I knew what was going on, and we could help take care of the patient as quickly and as efficiently as possible. I'm not the first person that's had this realization. I kind of stumbled into the transfusion safety officer as a career path and kind of looked into it and realized that it has a base, it's a foundational basement of education and communication. I was really drawn to that, and it deals with quality improvement and compliance. That is something that blood bankers are really good at, is compliance. And so having that information, I just did some more research and realized this is probably where I wanted my career to go. Have not only that kind of ability to influence, but just to learn more about what's going on the other side. So in the lab, we very rarely leave that basement windowless room of not having that opportunity to be at the patient's bedside. So we don't know what's going on until somebody calls and tells us. So I love learning more about what goes on leading up to that point when they're calling the blood bank and going, I need a lot of blood and I need it as fast as you can get it for me. And having that background, understanding why they're saying what they're saying, why they're asking for what they're asking for. It's been a really great opportunity.
I think it would be invaluable also to the healthcare organization to have that lab person out with the clinical staff because, my perception is working in a hospital is you always know that the lab is there, but most, I think even nurses don't even know maybe where the lab is located. And it's kind of like they're the invisible behind the scenes place that you call. It seems to me like the lab personnel are like these, what I have envisioned is these type A personalities that don't need to be seen, but they do so much to catch. I mean, if you were getting a call from the lab, it was usually because they had caught something you had missed. I mean, would you say that that's a good characteristic of the lab? I see them as people who are just in the background making our practice more safe.
Yeah, that's a pretty accurate description, I think, of the bulk of people who choose to go into clinical laboratory science. Is we're very detail oriented. I always kind of joke about that. It's like detail oriented. It's not a bug, it's a feature. You have a lot of things to keep track of. I can speak mostly to blood bank as that's the only section of the lab I've actually worked in professionally, but my training is in all of the areas. There's a lot to keep focus on. You have to keep kind of a lot of information in the forefront of your mind as you're doing this testing, as you're getting these patient results. So it's making sure, like, is the sample hemolyzed? Is it hemolyzed enough to warrant a redraw or not? Do I have enough sample volume to actually perform the test accurately? That's especially relevant, like in all of your coag tests. You have to fill that blue top up all the way, or the balance is wrong and you're going to get false results. And then that can have a profound impact on how you treat your patient. That's a lot of our education is it's not just a blood sample, that there's a patient on the other side of this that needs treatment. And it is your responsibility to make sure that they get the provider gets the right information so they can give the right treatment. That is fundamental to how we're taught our science behind it. There's a lot to kind of keep in the forefront of your mind. And the phone's ringing because then they'll call with questions and then we'll call back with answers. There's just always a lot going on. There's instruments and analyzers, they're beeping. And so you have to be able to pivot at a moment's notice. Being detail oriented, it helps you move about more efficiently through your processes. So that way you can help all of the patients that you need to.
Yeah, you can't make mistakes in the blood bank because you're giving products that could be extremely dangerous. They're already dangerous many times to begin with. And then if you make an error, it's a huge problem.
Yeah, that is always in the back of your mind. You have to make sure that you're getting it right because you are effectively giving a tissue transplant to a patient. And you've got to make sure it's right. So especially in the blood bank, they work really hard to eliminate those distractions.
So there must be a set of rules that you follow in the blood banking arena. Is that the hospital rules or is that something higher like the FDA or what is that?
All of the above. The FDA has a lot of regulations about blood products. A unit of red cells, they classify as both a drug and a biologic. That's twice as many regulations as you would expect. And it has to be pretty strict because, again, you're taking a biological product from one human and you're storing it in anticipation of giving it to another human. So we've got to make sure that all of the testing is done at the donor site. Whoever is your blood supplier, they have a long list of these regulations of how to collect and store, what testing to perform for those blood products, how to actually manufacture the components to turn into your packed cells, your plasma, your platelets, and your cryo, and then how they are able to pack those up and send them to the blood bank, stored and tested. It is a very long list. Unfortunately, that means it leaves the blood bank at your local hospital in place to defend and uphold those regulations to the rest of the hospital staff who don't have that knowledge, who weren't trained to that. So you can't expect them to know. So the blood bank is kind of left saying, I'm sorry, I can't test your sample for this reason. And that the main reason is the FDA set regulations that if I test the sample, I could cause harm. So that's the highest level, is the federal regulations. Below that, the laboratory has accrediting organizations, and those can be for the whole lab, which a lot of people are going to be familiar with CAP or the College of American Pathology. They have a lot of standards, not regulations. They have standards that the laboratory has to follow. So it's making sure, do you have policies and procedures in place to make sure that your samples are identified appropriately at the time of collection? Are you reviewing your quality control to make sure all of your tests are performing the way they're supposed to so that your results are accurate? And then they'll have very specific ones for each of the different lab sections. So you'll have blood bank and heme and so on and so forth. AABB has an accreditation just for blood bank. So your laboratory might be CAP accredited, but your blood bank could also be AABB accredited on top of it. Now, there's a lot of overlap between those standards for CAP and AABB, but there's a lot of them. And so the lab will actually get inspected every 2 years. It's an unannounced inspection, so you have to be in something called inspection readiness at all times because they could just show up. They can ask to look at all of the documents, review your quality control, review your policies and procedures to make sure that your blood bank or that your lab is generating accurate, precise results that are operational, that you can take them as a provider to then provide your patient treatment. Then your hospital might have its own local policies and procedures, and that's going to be more along the lines of, these are the things that we do, and this is why we're doing them. And then it can have more step-by-step instructions on what our specific policies are and how we are wording those regulations and standards within our own practice.
So safety and quality for the donor, the products, and the recipient, that's a huge responsibility. So thank you for that.
Yeah. Sure.
It seemed like whenever I talked to the blood bank, they were always getting ready for an inspection. Is that because you have more inspections than other areas of the hospital?
Yes. The rumor is that the blood bank is one of the most regulated fields of medicine. And I think that's mostly due to the fact that blood, like I mentioned, is a drug and a biologic. So it's got a lot of stipulations that you have to ensure are being followed. So your blood bank at any moment could be inspected by the FDA. It could be inspected by your state medical board. It could be inspected by CAP or AABB. The Joint Commission will also come in. So when your hospital has its triennial inspection, they may want to come in and talk to the blood bank as well. So there's a lot that goes into it, and they can come on any kind of set schedule. They can come anytime that there has been a reported event or something to follow up on. So there's, at any moment, somebody could walk in the blood bank and say, I'm here to inspect you, and you have to be ready for that.
We know all about the blood bank now. We're ready to roll. We're ready to hit the bench, right?
Sure.
What does all this have to do with patient blood management? How can laboratory professionals contribute to patient blood management?
Sure. So one of the things with our laboratory science education is we're not just taught how to perform the tests and why the tests are run, but we're also taught like a lot of the diagnostic criteria. So when we're thinking about blood banks specifically, we're going to learn the transfusion triggers and indications. We're going to learn what's the expected result once your patient has been transfused with whichever blood product is chosen. What's the outcome? So for example, with a red cell transfusion, you can expect your patient's hemoglobin for an average adult to go up approximately 1 gram per deciliter. So if you transfuse it at 6, at the end of the transfusion, they should be around a 7. We're also taught a lot of the transfusion reaction signs and symptoms. So when we're thinking about provider orders a blood product, somebody in the blood bank, depending, and this is where it kind of gets to the local policy. So there is a CAP and AABB standard that somebody has to review the blood bank orders for blood products to make sure that they were appropriate. How that is interpreted is going to be up to the local hospital. So one of the ways you can do this is as the orders come in, the laboratory technologist could be expected to go and look at the lab result that's relevant to that blood product. So we'll just keep it with red cells for the sake of simplicity. So if the ordering provider says, I'm ordering this because my patient's hemoglobin is less than 7, then you as the blood banker can log in to either your hospital EHR, it might print out on your order. You can actually look at that pre-transfusion lab result and if it matches. So let's say the provider is ordering it for a hemoglobin of less than 7 and you look and their hemoglobin is actually 9, you can escalate that to the next step. So within the laboratory operations with the technologists, they don't actually report up to the providers. It's very similar to how nursing and providers work together, in that you have your nursing leadership and then you have your providers, and there's not a hierarchy between them. It's much more of a partnership. In the blood bank, if I get an order for a blood product and it doesn't meet the transfusion criteria, I can escalate that. Now, at an academic medical center, that's usually a little bit easier. There's usually a resident that you can start with. They can do a little bit more of investigation into the patient's chart. They can reach out to the ordering provider and ask, like, what is happening in the clinical picture for this patient that's not necessarily being reflected with the lab. So, for example, if a patient is rapidly hemorrhaging, your lab result isn't going to be accurate because your circulation hasn't evened out that rapid bleed. So if it's something like that, then obviously you would transfuse if that was deemed appropriate for the patient. But if it's, they're stable, maybe they were looking at an older lab result. So you could potentially prevent an unneeded transfusion just by looking at those pre-transfusion labs. The same goes for dose. So one of the things that we talk about a lot at my facility is what's the appropriate dose for a plasma transfusion to get the effect that you're looking for. For adults, plasma is actually transfused on a weight-based dosing, which is different from all other adult blood products. You usually associate that with pediatric transfusions. For plasma, you're going to dose it for 10 milliliters per kilogram of the adult weight, and making sure that if they're only ordering like a single unit of plasma for an adult, that's not nearly enough. So for the average adult, you're going to need to give them about 600 to 800 milliliters of plasma to get the achieved result. And that might be too much for that patient. One of the stories that I like to share is unfortunate because the patient was actually my grandmother, and she had a lower GI bleed and was admitted to the hospital, and she had, coronary artery disease. She had a couple of histories of needing a bypass due to a heart attack. She had type 2 diabetes, she had high blood pressure, and now she developed this lower GI bleed. So when they did her admitting labs, because of her history of coronary artery disease, she was on warfarin. And they saw that her INR was relatively elevated. It was somewhere between 4 and 5. She was bleeding, and so they're like, oh no, we've got to stop this bleeding. And so they ordered a large dose of plasma for her. So they ordered 4 units of plasma, and they transfused them very quickly because they were trying to stop this bleeding. But unfortunately, what happened was she went into circulatory overload. She ended up getting intubated. She had just extreme respiratory distress. So she had to be intubated, all from a transfusion trying to prevent this bleeding when it wasn't necessarily the right product, even though it was the right volume to get what they were hoping for, but she couldn't tolerate that volume because of all of her other diagnoses that she had. With that coronary artery disease, she had a very significant heart history. And so they gave her a very large volume very quickly, and it just overwhelmed everything, and it put her into congestive heart failure. Happily, she did survive that particular event, but it was 3 days before my wedding. It is stuck in my mind quite vividly. So luckily, she wasn't able to make it to the wedding, obviously, but we were able to visit her. That's kind of looking back on it as I've been moving into this part of my career. That's kind of where I started with just because transfusion was an option didn't mean it was the right option. There were other things that could have happened to prevent that harm.
I'm so glad you brought that up because that's really a core thing in patient blood management, not just recognizing that we're treating the patient and their individual scenario. And it's also nice to think about for you as a blood banker, all these people out there that are donating a product of their body, their own body, and we should be treating that with the utmost respect. We should be using that product only when it is absolutely appropriate. And so that's like really 3 people there that we kind of just, went cavalier and just used it and probably should not have. So that's unfortunate that that was wasteful. And we really should have been focusing on Graham and her situation and her heart and her individual blood health. So thank you. That was an awful story, and I'm glad she's doing okay, but it was actually a perfect story.
Thank you.
What could a lab personnel do about that order? Like, how could they have intervened in defense of patient blood management?
So in this particular circumstance, it goes back to that local hospital's expectations. If the hospital expectation was to review the labs, then it would have seemed appropriate. But if there's also an expectation to look at the patient's diagnosis. So one of the hospitals I used to work for, the patient's diagnosis actually printed out on the order. So I had their diagnosis, I had their lab value, and I had what they were trying to order. So in this case, if somebody saw we have an elderly woman with a history of coronary artery disease, and they've ordered 4 units of plasma, that warrants a conversation because that history of heart disease means that she's going to be much less able to tolerate a large volume very quickly. And so you order 4 units of plasma stat, they're going to give them rapid fire. That's one of those situations where you, as the technologist, can escalate that to your medical leadership and say, I got this order for 4 units of plasma on this woman. Yes, her INR is elevated. However, she has this extensive cardiac history. Can you talk to the team? Is this appropriate? Can we maybe run it slowly? Is there another pharmaceutical drug that we can give to reverse the warfarin action? So there was something else. And so it's kind of coordinating. It's making sure that the medical leadership for the blood bank is aware of the patient and their history, and then they can have those conversations with the ordering provider to choose whether it's transfusion or not the safest option for that patient. Transfusion is the safest it's ever been, but it doesn't mean it's always safe for the patient in that moment. There's usually another option that might be a little bit better right now that we should explore.
Very good. Thank you for just showing us what valuable, team members our laboratory professionals are. And we certainly appreciate you and the transfusion safety role that you play in educating us, clinical staff, because it is true. Our education in transfusion is very minimal. We get a yearly assignment usually from our healthcare organizations, but it's not enough. So that daily reminder and knowing the person who is the professional and who is well trained is just very invaluable for an organization. As a takeaway to our audience, what would you like them to really take away from our conversation today regarding laboratory professionals and patient blood management?
I think the biggest takeaway is your partners, your colleagues that work in the lab, they chose that career because they do want to help people. They still want to be part of the healthcare team, and they have a wealth of knowledge, and it doesn't matter which section of the lab they're working in. They understand how that lab test is performed. They understand why it's important. They understand how the results can lead to a diagnosis. And they are really an untapped resource for that knowledge. And questions are always welcomed. We like people to reach out and ask us about what we're doing and why it's important and how that can help take care of the patient. There's several articles out there that talk about, for every healthcare decision that's out there, 70% of those diagnoses come from a lab value or a lab test, that it's integral to how you care for your patient. And it's not just the pathologist whose name shows up on the report as being the owner of those results. It's the person who's performing the test. They are intimately familiar with all of that minutia about it, and they want to share their knowledge. They want to share their experience to help you as the provider, you as the nurse, to take care of that patient to the best of your ability. It's an unseen part of the hospital because it's usually tucked in the basement, or it's tucked in a part of the hospital that doesn't have a lot of throughput, whether it's visitors or faculty or staff. We're usually a little bit hidden, but knowing that they're there and always being able to use them as that resource, even if the person you get on the phone isn't the right person, they know who the right person is to get you the answer that you're looking for. Just kind of remembering that they're there, even though you don't ever see them face to face.
Great conversation. Thank you for having it. I certainly hope that our audience, whether they're clinical or whether they're a patient, really has a greater understanding of the value of our lab professionals and how they contribute to patient blood management.
This was fantastic. Thank you so much, Kaycie, for joining us today.
Thank you for having me. This is great.